Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome to our 6th episode of Workers' Comp Unwrapped.
Thanks for having me.
We've got Aisha here. She's an expert.
Oh, wow, expert.
With 15 years
I like that.
of experience in the workers' comp industry.
I'll take it.
And today,
Yeah?
we're talking about billing for different medical specialties.
Yes.
So, Aisha, before we get into the specifics for each specialty, let's make sure everybody is on the same page.
Okay.
What exactly is workers' comp, and why is it so different
Yeah.
from regular insurance?
That's a great question, and honestly one I get a lot.
Yeah.
Workers' compensation is really there to protect employees
Okay.
who are hurt or become ill as a result of their jobs. It's meant to cover their medical bills and replace some of the wages that they lose while they're recovering.
Yeah, that makes sense.
The tricky thing, though, is that it involves a whole bunch of different people.
Okay.
You've got the employers, you've got the insurance companies,
Right.
third-party administrators, and, of course, the injured worker.
So it's more than just a patient and a doctor.
Way more.
Okay.
Way more. And that's why documentation is so important.
Gotcha.
Because you really need to prove
Yeah.
that every treatment is directly tied to that work injury.
So it's really about telling a story with that documentation.
Absolutely. You need a solid narrative.
Okay.
I think incident reports, employer sign-offs, progress notes, it
Yeah.
all has to fit together.
So it's not just about treating the injury. You have to kind of prove
Yes.
that it happened because of work.
You said it perfectly.
Okay, so detailed documentation is key, but I imagine there's more to it, right?
There is.
Yeah.
And another big difference from regular insurance
Yeah.
is that workers' comp uses fee schedules,
Okay.
which are often set by each state.
So they can vary.
They can, and often they're lower than what doctors are used to.
Okay.
So it's really important to know your state's fee schedule.
To make sure you're getting paid fairly.
Exactly. You don't want to underbill yourself.
Okay, so we've got the documentation and the fee schedules.
Those are the non-negotiables.
Got it. But I imagine different specialties have their own unique challenges.
They do. Let's start with orthopedics.
Okay.
They see a lot of workers' comp cases,
Yeah.
especially in physically demanding jobs.
Makes sense. Construction workers, factory employees.
Exactly. High-risk occupations.
Right.
We're talking fractures, sprains, repetitive stress injuries.
Gotcha.
And the documentation really has to be thorough.
Like what kind of things?
Well, if there's surgery, you need detailed operative reports.
Okay.
All the diagnostic imaging, x-rays, MRIs,
Mm-hmm.
progress notes, long-term treatment plans.
Especially if there's physical therapy involved.
Yes, definitely.
So orthopedists have to be meticulous.
They do. But even then, they often face pushback from insurers.
What kind of pushback?
Well, one of the big things is justifying the need for surgery
Okay.
or even extended follow-up care.
So they're questioning
Yes.
the necessity.
Exactly. They want to know if less invasive options were tried first.
So it's almost like you have to anticipate their questions
In a way, yes.
and address them in the documentation
Precisely. So you'd want to document all the conservative treatments you tried.
before even considering surgery
Right. Things like medication bracing physical therapy.
and the outcome of those treatments.
Absolutely. You need to show that you didn't jump straight to the most expensive option.
So you're building a case to support your recommendations.
Exactly. That's a great way to put it.
Okay, so that's orthopedics. What about physical therapy?
Another big one in workers' comp.
Yeah,
But they have their own set of documentation quirks.
I bet. So what do they need to be extra careful about?
It's all about showing measurable progress in every single session.
Okay,
You need to prove that those therapy sessions are making a real difference.
what would that proof look like?
Think quantifiable improvements. Like, did the patient's range of motion increase?
Okay.
You'd use a goniometer and record the numbers.
Gotcha.
Did their pain level go down? Use a pain scale to keep it objective.
Makes sense.
Can they do their daily tasks more easily? Document all of it?
So instead of just saying the patient is feeling better,
Right.
you're giving concrete evidence.
You got it. But here's the thing.
What's that?
Insurers often question the length of treatment.
Yeah.
They want to know why those sessions are continuing.
They're watching the bottom line.
They are. So how can a physical therapist justify those continued sessions?
Good question.
By connecting the treatment plan directly to the patient's work-related goals.
Okay.
So let's say you're treating a cashier who needs to be able to stand for long periods.
Right.
Your documentation needs to show how each session is helping them regain the strength and endurance.
to do that specific task.
Exactly. You're not just aiming for general improvement.
You're targeting the skills they need for their job.
That's the key.
Okay.
Make it clear to the insurer why those sessions are essential
For that worker's recovery.
and their return to work.
Okay. Now let's talk about a specialty that might not be the first thing people think of
Okay.
when they think workers' comp, dentistry.
You'd be surprised how often dental claims come up. Yeah, especially in jobs where there's a risk of facial trauma.
Like what kind of jobs?
Think law enforcement, construction, even some factory jobs with machinery.
Okay, so what's the documentation must have for a dental claim?
You need a really detailed injury report
Okay.
that explains what happened, when and where on the job site.
Mm-hmm.
Then you'll need x-rays and any other imaging.
To show the extent of the damage.
Exactly. And here's the critical part.
What's that?
You need a rock-solid connection between that workplace incident.
And the dental injury.
Yes. It's not enough to just say they have a cracked tooth.
Right. You have to prove it happened because of work.
Exactly. But even with all that, dentists often face pushback
On what?
on high-cost procedures, like implants or crowns.
I see.
Insurers might push for a cheaper option.
Even if it's not the best.
Yeah, even if it's not ideal in the long run.
So how do you advocate for those higher cost procedures?
Transparency is key. You lay out the alternative treatments and their costs alongside your recommendation. And then you explain why the more expensive procedure.
The implant, for example.
Yes. You explain why it's the better choice.
Okay.
What are the long-term benefits? How will it affect the patient's ability to work?
And their quality of life?
Exactly. You're giving them the whole picture.
So you're almost making a mini presentation within the documentation.
That's a great way to think about it. You're not just saying what you want.
You're explaining why.
Exactly. Why it's the best route for everyone involved.
Okay, let's move on to another specialty that often deals with long-term care
Okay.
and can face some skepticism from insurers. Pain management.
Pain management is so important in workers' comp,
Yeah,
especially for chronic conditions like back pain or neuropathy.
right.
But justifying the ongoing need for treatment can be tough.
Especially when it comes to things like opioids.
Yeah, there's a lot of scrutiny around those.
Understandably.
Right.
So how can pain management specialists address those concerns?
Well, your treatment plan needs to be evidence-based. You're showing insurers that your approach is backed by research.
Makes sense.
But it's not enough to just describe the pain.
Right.
You have to focus on how pain management is improving the patient's function.
So how do you demonstrate that functional improvement?
Show them how pain management is helping the worker get back to their daily life.
Give me some examples.
Can they do everyday tasks more easily? Are they able to participate in physical therapy?
Because their pain is under control.
Exactly. Are they sleeping better? Are they engaging in social activities again?
So you're showing how pain management is improving their quality of life.
Yes. And that's what insurers want to see.
Okay, now let's talk about a specialty that often faces a unique challenge.
Okay.
Psychiatry and psychology.
Yeah. Proving the link between a mental health condition and a work-related event,
Can be tough.
it can be. Whether it's PTSD, anxiety, or depression,
Right.
you need meticulous documentation to show that it stems from a specific incident at work.
So that initial evaluation is crucial.
It is. That's your foundation.
What are the absolute must-haves in that first evaluation?
You need a detailed account of the patient's mental health history,
Okay.
their current symptoms, and a clear description of that workplace event.
That triggered or worsened their condition.
Right. But don't just mention the event, create a timeline
Okay.
that links the onset or worsening of their symptoms directly to that incident.
So you're really connecting the dots for the insurer.
Exactly. And just like with other specialties, progress reports are key.
Yeah.
Show how therapy is impacting their daily functioning. Are they sleeping better?
Are they able to concentrate?
Yes. Are they engaging in social activities again?
So you're painting a clear picture
Yes,
of how the work-related incident is affecting their mental well-being.
absolutely. Now let's talk about one more specialty
Okay.
that often faces an uphill battle in workers' comp:
Which one is that?
chiropractic care.
I've heard that chiropractors sometimes struggle to get their services covered.
It's true. There's often skepticism from insurers.
So what's the best way to approach that?
It all starts with a super detailed initial assessment.
Okay.
Don't skimp on this one. Record everything.
Like what kind of things?
Range of motion pain levels, postural imbalances, any neurological findings.
Ajay.
And just like physical therapy, you need to show measurable progress with each treatment.
I imagine objective measurements are really important here.
They are. You can't just rely on the patient saying they feel better.
Right.
Use tools like goniometers for range of motion.
Okay.
Document pain levels with a standardized scale, assess their ability to perform work-related movements.
So you're backing up your treatment plan with solid evidence.
That's the goal. And here's another key point.
What's that?
Tie your treatment plan to specific work-related goals.
Right.
So if you're treating a construction worker with back pain,
Yeah.
explain how each adjustment is helping them regain the mobility and strength.
To do their job.
Exactly. You're not just alleviating pain.
You're restoring function so they can return to work.
That's the goal. And stay current on the latest research. The more evidence-based your methods are, the stronger your position will be.
That makes sense. This has been so insightful, Aisha.
Oh, thank you.
We've covered a lot of ground here.
I have.
From those universal workers' comp basics
Right.
to the specific nuances of each specialty.
Yeah, but there are even more general challenges
Well, sure.
that any doctor billing for workers' comp needs to be aware of.
Okay, so let's unpack those in our next segment.
Sounds good.
Okay, so let's talk about those universal challenges.
Yeah.
I'm guessing denials for insufficient documentation
Oh, absolutely.
are at the top of the list.
It's a classic.
We've touched on how crucial good documentation is,
Right.
but what are some common oversights
Okay.
that can lead to those denials?
One of the biggest things is not clearly connecting the injury or illness to the work environment.
Okay.
You have to make that connection crystal clear.
In every report.
Yes. Every single report, every progress note needs to explicitly link the patient's condition
Yeah.
to something specific that happened on the job.
So it's not just about describing the symptoms and the
Yeah.
treatment.
It's about proving that work was the cause.
Gotcha. So cause and effect.
Exactly. Cause and effect.
Okay.
What else? Another common mistake is missing details about the mechanism of injury.
The mechanism of injury.
Yeah, how exactly did it happen? What were they doing at the time?
I see.
Those details matter
Because,
because they paint a clearer picture for the insurer.
okay, it's like those crime shows
Yes.
where they recreate the crime scene.
I love that analogy.
You have to give them enough information
Exactly.
to understand how the workplace contributed to the injury.
You're giving them the evidence they need.
Okay, so we've got the connection to the work environment
Yes.
and the mechanism of injury.
Right.
What else can trip doctors up?
Well, another headache is delays in authorization for treatment.
Yeah,
Workers' comp often requires pre-authorization.
and that can take time.
It can. And that can delay the care the patient needs.
I bet that's frustrating for everyone involved.
Oh, it is. So what can doctors do to make that process smoother?
Yeah, any tips?
Well, building a good rapport with the insurers and TPAs can really help.
Okay.
Open communication is key.
Make them your allies.
Exactly. And when you submit those authorization requests,
Yeah.
make sure they're complete. Don't give them a reason to stall.
So be proactive.
Yes. Be proactive. Anticipate their needs.
Make their job easier, and they'll make your job easier.
That's the idea. Now, another tricky area
Okay.
is when disputes arise over the length of treatment or the cost.
Yeah.
Insurers might argue that the care is going on too long.
Or that it's too expensive.
Exactly.
So how do you balance advocating for your patient
It's tough.
with the insurer's desire to control costs?
It is. This is where that meticulous documentation comes in.
Okay.
If you've been tracking the patient's progress,
Yeah.
showing those improvements with each session,
Right.
you have a much stronger argument for the duration and cost.
You're proving the treatment is working.
Exactly. And
Okay.
that it's worth the investment.
Okay, so documentation is key. But what about evidence-based guidelines?
Oh, those are essential too.
How so?
Whenever possible, you want to show that your treatment plan aligns with the latest research.
Makes sense. It gives your recommendations more weight.
Exactly.
Why?
Now let's talk about state-specific compliance issues.
Oh yeah, that sounds complicated.
It can be. Each state has its own set of rules.
And if you don't know the
You
rule?
can get into trouble.
So what are some common mistakes in this area?
Missing deadlines is a big one.
Deadlines for what?
For filing claims, for submitting documentation.
Yeah.
Those deadlines are often strict.
And if you miss them?
You could face denials.
So no room for procrastination.
Nope. You have to be organized.
Are there any tools that can help with that?
Absolutely. Investing in specialized billing software can be a lifesaver.
Okay.
It can automate a lot of tasks, track those deadlines,
Yeah.
and help ensure you're in compliance.
So it's worth the investment.
Definitely. Now, we've talked about the challenges,
Right.
but let's focus on solutions.
Okay, good idea.
Yeah.
What are some best practices?
Well, having a well-trained billing team is crucial.
They're your front line.
Workers' comp billing is its own beast.
Yeah.
It requires specialized knowledge.
So invest in training.
Yes. Or consider outsourcing to a billing service that specializes in workers' comp.
Okay, so don't try to go it alone.
Exactly.
What about software? We talked about that a little bit.
Yes. Having the right software can make a huge difference.
Streamline your billing, reduce errors.
Exactly. And what about communication?
Communication is always key.
It is, especially in workers' comp.
So who do you need to communicate with?
Everyone. The patient, the employer, the insurer, the TPA.
Keep everyone in the loop.
Exactly. Be proactive with your communication.
I like that.
It can prevent a lot of headaches.
So build those relationships.
Yes. And don't forget about internal audits.
Internal audits.
Yeah, regularly review your billing practices.
Okay.
Check for errors.
Yeah.
Make sure you're following the rules.
So it's about continuous improvement.
Exactly.
Yeah.
You got it.
Okay, so we've talked about the challenges and some best practices.
Right.
But let's see how this all plays out in the real world.
Okay.
Do you have any success stories to share?
I do. Let's start with a physical therapy practice.
Okay.
They were struggling with a ton of denials
Because of...
because they weren't submitting complete progress reports.
we talked about how important those are.
Right. They were doing great work with their patients,
No?
but their documentation wasn't telling the whole story.
So how did they turn things around?
They implemented a digital tool
Okay.
that allowed them to track each patient's progress in a more visual way.
So instead of just writing notes,
Yes.
they were using graphs and charts.
Exactly. They could show those improvements.
In range of motion, pain levels,
Yeah.
functional abilities.
It made it easier for the insurer to see the value of the treatment.
A picture is worth 1,000 words.
Exactly. And their approval rate jumped by 35%.
Wow, that's impressive.
It is. It shows the power of the right tools.
What other success stories do you have?
Okay, let's talk about a dentist
Okay.
who was treating a factory worker with a serious facial injury.
Okay.
This dentist was incredibly thorough with their documentation.
In what way?
They used photographs and x-rays.
To document the injury.
Yes, every step of the recovery process.
Mark.
The insurer initially denied coverage for an implant.
Oh, really?
Yeah, they wanted a cheaper option, but because the dentist had such detailed documentation,
Yeah.
they were able to appeal and get approval for the implant.
So they fought for their patient.
They did, and they won.
That's great. Do you have a case from the mental health field?
I do. This one involves a psychiatrist
Okay.
who was treating a patient with PTSD after
Yeah.
a traumatic assault at work.
Okay.
This psychiatrist was amazing.
What did they do?
They used detailed patient interviews, timelines,
Wow.
even evidence from the employer.
To prove the connection.
Yes, to demonstrate that link between the PTSD and the work incident.
And it worked.
It did. They got full approval for ongoing therapy.
That's fantastic. These success stories are so encouraging.
They are.
They show that workers' comp billing can be challenging,
Yeah.
but it's not impossible.
Not at all. With the right approach.
Doctors can get fairly compensated.
Absolutely.
Okay, but before we wrap up, we need to touch on the legal side of things.
Yes, that's important.
It's not just about getting paid.
Right.
It's about doing things the right way.
To protect yourself and your patients.
So what are some legal pitfalls to avoid?
Okay, well, missing deadlines is a big one.
Yeah, those deadlines we talked about.
Exactly. If you don't file those claims or
Yeah.
submit the documentation on time,
Yeah,
you risk getting denied.
and those denials can be permanent.
Sometimes they are.
Yeah.
So yeah, you got to stay organized.
No room for procrastination.
Not at all. And another legal trap to watch out for
Yeah.
is upcoding.
Upcoding.
Yeah, that's when you bill for a more complex service
Right.
than what you actually provided.
I'm guessing that's considered fraud.
It is, and it can have serious consequences. Big fines, potentially even losing your license.
Yeah, definitely not worth the risk.
Not at all. So yeah, honesty and accuracy are crucial.
Absolutely. Okay, so we've talked about the legal pitfalls,
Right.
but what about ethical considerations?
Those are important too.
What kind of ethical challenges do doctors face with workers' comp?
Well, one that often comes up is overtreatment.
Overtreatment.
Yeah, it's a tough balance.
How so?
You want to give your patients the best care,
Right.
but you also want to avoid unnecessary treatments.
So you don't want to overdo it.
Exactly. Overprescribing medications, recommending excessive therapy.
Yeah, that can raise red flags.
It can, and it can damage your reputation.
So it's about finding that balance
Yes.
between providing great care
And being mindful of costs.
and resources.
Exactly.
And another big ethical consideration is patient privacy.
Yes.
You have to protect that confidential information.
Especially with so many parties involved.
Exactly. So many people need access to those records.
Yeah, so any tips for protecting patient privacy? Well, always use secure methods for transmitting data.
Okay.
Things like encrypted email or secure messaging platforms.
Makes sense?
And be careful about how you discuss patient information
Yeah.
with other providers or staff members.
Need-to-know basis.
Exactly. Need to know.
Okay, Aisha, this has been so insightful.
Oh, thank you.
We've covered so much ground today.
We have.
From the unique challenges each specialty faces
Right.
to those best practices, legal pitfalls, ethical considerations.
It's a lot to take in.
It is.
Yeah.
So what's the key takeaway you want our listeners to remember?
Workers' comp billing requires precision, adaptability, and proactive communication.
Okay.
You can't just wing it. You have to be prepared, organized, and proactive.
To make sure you're getting paid fairly.
Exactly, for the services you provide.
I couldn't agree more. This has been an eye-opening conversation, Aisha.
Thank you.
Your insights have been so valuable.
Oh, my pleasure.
You've really shed light on this complex world of workers' comp billing.
That's my passion.
For our listeners who want to learn more, where can they find additional resources?
I encourage everyone to visit www.medicallynmgt.com.
Okay, we'll include that link in our show notes.
Perfect.
Aisha, thank you so much for joining us on Workers' Comp Unwrapped.
Thank you for having me. I really enjoyed it.
And to our listeners, thank you for tuning in.
Yes, thank you.
We hope this deep dive into workers' comp billing has been helpful.
We hope so.
Remember, knowledge is power.
It is.
And by staying informed and proactive,
Yes,
you can ensure your practice thrives in this complex but vital area of healthcare.
absolutely.
Until next time, take care. Thanks for listening to Workers' Comp Unwrapped. If you found value in today's episode, subscribe and share with fellow doctors. Stay informed and keep making a difference in your patient's care.